Hi, everyone. Thanks so much for joining us today. I want to welcome everyone to this webinar. Today, we're going to be talking about chronic care management and our new partnership with Enable Healthcare. So basically, our agenda for today is just a quick introduction that I'm going to provide, and then we're going to have a CCM slideshow presentation. We also have a customer testimonial to share with you all. We also have some success stories by one of the CCM staff members, and then we'll finish this out with a Q&A session. So just a quick introduction to everyone that is on the call, but with the Prognosis Harris team as well as the EHI team. So on the Harris team, we have Dia Ranjan, who is our moderator for the meeting here, who's set everything up in GoToWebinar and is managing that. Also myself, and we have James Cleary, who's Vice President of Chronic Care Services. And then most of you will all know one of the sales members' names. So we have Kemp Stevens here, Ramesh Murthy, Mandy Chilson, and Sridhar Babu Morkanda. So all the sales team here from the Bismatic side will all be helping you with any of the questions and things that you have on the CCM services. From the EHI team, we have Dr. Josh Barron, who has been on the technology side of things for over a decade. He's worked a lot with Epic and Cerner implementations. He has been the subject matter expert for EHI for a couple of years now, and his presentation, I think, will give you a lot of great information about CCM. We also have Priyanka Patel, who's the CCM Practice Relations Manager, so she's going to share some anecdotal information, some client success stories, some things that happen in CCM services, just to give you a better taste and feel for the interaction that the CCM staff would have with your practice. And then we also have Anthony Sabaya, who is the President and Manager of Sales for EHI. So thank you and welcome everyone today. And I'm going to go ahead and start with a presentation by Dr. Barron.
Thank you for joining Harris and EHI's Chronic Care Management presentation. Today, what we'll cover in the webinar will be, number one, what is the Chronic Care Management Program? What are the benefits of the Chronic Care Management for the 3 Ps, patients, physicians, and payers? We'll talk about the strength of our CCM clinical staff and the kickoff process for beginning the Chronic Care Management Program. First, what is the Chronic Care Management Program? Well, the Chronic Care Management Program was an initiative that was started a few years back by CMS, the Centers for Medicare and Medicaid. And the idea here was to bridge the gap in patient care. Now, even though this was a CMS initiative, several of the commercial payers have taken on this program and will reimburse for the program as well. The way it works is for any patient on the Chronic Care Management Program will develop a chronic care plan. And that's basically developed based upon evidence from the medical literature of what should be done for a patient with, say, a chronic condition like diabetes or with a congestive heart failure. After that chronic care management plan is developed, there will be CCM engagement calls. And those can be phone calls or text messages at least once a month. And the idea here is to reinforce the care plan and to increase compliance of patients with the care plan, to ensure that patients are doing what they're supposed to, what their doctors ask them to do for disease management. The end goal here, and CMS has actually proven this to be the case, is that patients are less likely to be admitted to the hospital because of the early intervention in symptoms. To participate in the Chronic Care Management Program, patients need to have at least 2 chronic conditions that are expected to last at least a year or until the demise of the patient. These chronic conditions must place a patient at significant risk of death, acute exacerbation, decompensation, or functional decline. The good news here is that this is very vaguely defined. So, for example, we tend to think of chronic conditions as those things like diabetes, like congestive heart failure, but this would also apply to chronic conditions like depression or anxiety. Ultimately, the comprehensive care plan is established, implemented, and periodically reviewed. So again, examples of some chronic conditions can include Alzheimer's disease, dementia, arthritis, atrial fibrillation, cancer, cardiovascular disease, depression, diabetes, hypertension, and any chronic infectious diseases. So the nice thing for you is that there is increased direct revenue from the chronic care management. And again, CMS has proven this program to be helpful, so they are willing to increase reimbursement for the program. And so the reimbursement ranges between $59 and $210 per patient per month. And that's variable based upon the geographic area as well as the time that's spent with the patient. And we'll talk a little bit more about that. And again, there's a decrease in ER visits and unscheduled hospitalization, leading to reduced healthcare costs overall. So this is good for payers as well. So looking at an example of how revenue can be generated, let's assume that there's 500 beneficiaries that are available. Let's say that 80% of them have elected to participate and are eligible for the program. So assuming there's 400 patients that agree, and assuming a monthly payout of $60 per patient per month, what we're looking for is the total potential monthly revenue for chronic care management of $24,000, or on a yearly basis, nearly $300,000. So this can really help your practice. For the patient compliance improves, their health improves, quality measures go up for MIPS and value-based care measures, which also benefits you. There's, again, fewer hospital admissions and ER visits. That's great for the patient, right? Because they're exposed to less in the way of iatrogenic infections. Care can be managed, of course, in the outpatient setting. And again, because the revenue is going to your clinic as opposed to the hospital down the street, that is increasing your practice revenue. And of course, there's improved communication with patients that improves the patient's health. It improves the patient's satisfaction with the practice, and of course, decreases gaps in care as the program was intended. So the hallmark of chronic care management billing is the 99490 CPT code. And this is for the first 20 minutes of clinical staff time that's directed by a physician or other qualified healthcare professional per calendar month. And that includes the time that's spent working on the care plan, the introductory call. It includes the monthly phone calls or check-ins with the patient. And for the 99490 code, by itself, it pays between $59 to $85 per month, depending upon the region of the country. Now, let's say that rather than spending only 20 minutes with a patient or on a patient's care plan, you spend 40 minutes or even 60 minutes, the reimbursement can go up pretty significantly. So there is a 99439 code that can be billed once if a threshold of 40 minutes is reached, or twice if a threshold of 60 minutes is reached, in addition to the 99490 code. So essentially, this allows practices to be reimbursed for more time spent with patients. And the 99439 code pays for each instance $44 to $63. This is variable per region. So let's say you have a patient in the state of New Jersey that requires 40 minutes of time on calls and for, let's say, revision of the chronic care plan. We can bill the 99490 once for $69. And again, 99490 you bill only once, but then you can bill the 99439 once. That pays $52 for the extra 20 minutes that you've spent with the patient for a combined revenue of $120. And of course, if we had spent a total of an hour on this patient, that would go up by another $52 to have a monthly revenue of $173. So let's talk a little bit about the kickoff process. The first thing we would do is we would meet with you to talk about roles and responsibilities. And the best thing that we can ask you to do is to really talk up the program, put posters up in your office when patients are eligible for the program, talk about the benefits of the program for that individual patient. We will be responsible for performing data migration to the CCM platform and for determining which of your patients are eligible for the program. We'll promote the program. We'll send out a CCM introductory letter, a postcard campaign for your patients. Again, we'll send you posters for the practice. We will set up the CCM app for you and train you on how to use it. And what we need from you, we need a voice script. So we can actually give you a script and have you record talking about the CCM program. And then we'll do an automated call to your patients that are eligible for the program with your voice, talking about the CCM program. We also need to understand your patient demography. So what is the socioeconomic status of your patients? That pertains to how we approach the patients. If there's if there's challenges in putting food on the table, for example, we can get patients hooked up with Meals on Wheels. We want to hear about your concerns regarding compliance. You know, are certain patients going to be harder to capture than others? And we also want to know what languages are spoken by your patients so that we can make sure that we communicate with patients in their primary language. We will write the chronic care management care plans based on evidence from the medical literature. However, as clinicians, you have the option to modify these specifically for each patient. And again, we will reinforce whatever chronic care plan that you provide for us and ensure that the patient is following it to a T. We'll introduce our care coordinators and establish the number of practices, our after-hours service protocol, and specific nursing instructions. And then we'll provide ongoing support. I mentioned that we do a data migration initially to figure out which of your patients are eligible for the program, but we'll do this at least monthly. Additionally, we'll have bi-monthly meetings to review patient compliance, review those patients not seen in the prior 9 to 12 months, and also the financial benefits that you're reaping from the program. So we've been providing chronic care management since 2016. And our CCM nurses are essentially an extension of your staff. So again, we engage patients in the patient's primary language. We assist with maintaining the care plan, and we will write the notes on your behalf. And then, at least on a monthly basis, we'll have you review the notes and approve the notes. And again, our CCM clinical staff, by definition of the CCM program, need to be available 24/7 for patients' concerns. So we'll provide you a route for your patients to get in touch with our nurses. So our CCM nurses on our at least monthly calls will review with your patients their medications, their need for refills, any side effects that the patient's having on the medication, common signs of disease exacerbation. So for example, for a patient with diabetes, are they starting to experience blurry vision? Any hospitalizations or ER visits, the socioeconomic aspects of patient care and barriers to care. For example, is the patient able to get to their appointments? Do they have adequate transportation? We'll ask them disease-targeted questions about their chronic conditions, and then detail any gaps in care and whether patients are keeping up with vaccinations, and then prescribe tests and procedures. And then we'll check on the schedule of visits and encourage the patients to attend all of the visits that are scheduled for them. Our nurses will communicate with your practice on an as-needed basis. For example, if a patient needs an appointment, we'll give your office a call and set that up for them. If the patient needs refills, we'll inform you. And if there's any particular concerns, we'll let you know about those as well. Clearly, if a patient is seen in the ER or hospitalized, we know that you want to know about that, and we will communicate that for you. And then finally, if we complete a screen, such as a depression screen or fall risk screen, and have some concerns about the results, we'll let you know about that as well. So I'm going to stop here and see if you have any questions for us about the chronic care management program and how we will pursue this.
So we're going to hold on those questions and go ahead and play a testimonial from one of EHI's clients first. And we will hold the questions until after that session, until after Priyanka has had a chance to speak as well.
Dr. Hazarian, thank you so much for joining us today. Just for everyone's benefit, Dr. Hazarian is an internal medicine specialist in Long Island City, New York. And thank you again, Dr. Hazarian, and welcome.
Oh, thank you so much. It's a pleasure being with you.
Thanks so much. So just to start, Dr. Hazarian, how long have you been participating in the CCM program?
So approximately 7 years. I started in 2015.
Okay, so you have pretty prolonged experience with it. That's great. And in your opinion, how has participating in the CCM program affected your practice?
So yeah, I was very surprised that it evolved my practice into something that it really wasn't before initiating the CCM program. Patients feel very comforted by the fact that they have somebody looking out for them. The nurses are calling them, and they feel like my practice is overlooking their situation and caring for their needs.
Okay.
It's reduced their it's reduced really people getting very sick where they require hospitalization. It's taking care of people's needs before certain diseases or situations can become worthy of hospitalization.
Can you think of a particular instance recently where a patient came in and shared that experience with you?
Yes, of course. Actually, a few times I had patients that we were able to diagnose much earlier on using the nurses that alerted me to the fact that there was a problem, which probably would have occurred maybe days or even weeks later without the CCM program. One example was a lady that she had urosepsis quite a few times. And every time she developed a urinary tract infection, by the time she was able to get treatment, it'd be too late. And I think one time she also had the urinary tract infections affecting her kidneys and pyelonephritis. And that would, of course, necessitate prolonged hospitalization stay. Sure. And, increased morbidity and mortality, of course. So, in these cases, she would alert the nurses that she was having some discomfort with her urination and go to the bathroom frequently, urgently, and all those things. And, I was able to, have her come in and do a quick urine analysis and culture, find that she had an infection, treat her promptly with antibiotics before, got to the level of urosepsis.
Great. So it sounds like the program has really had the benefit on your patients of being able to catch symptoms early and intervene early before the patient ends up in the ER or even being hospitalized.
Yeah, I think that's its greatest benefit.
So other than that, Dr. Hazarian, is there anything else you'd like to share about being in the CCM program and either your interaction with the CCM nurses or your patients' interactions with them?
From my experience, the nurses have been very courteous, respectful. My patients are very happy with speaking with them. Like I said, they feel comforted. They feel like my practice is encompassing all their needs. And, I would give it very high marks in that regard.
Well, thanks so much, Dr. Hazarian. I appreciate you coming today and have a great day.
Oh, my pleasure. Thank you.
Take care.
All right. Bye-bye.
And at this point, I'll turn it over to Priyanka, who is going to share a little bit more information with everyone.
Hello, everyone. My name is Priyanka. I'm a client relations specialist with EHI for the Chronic Care Management Program. On a daily basis, we continue connect with our practices and our patients for patient request, care coordination, appointment scheduling, general medical needs and questions that the patients might have when our nurses are conducting the monthly follow-up calls with the patients. We build a relationship with our patients and practice for effective and continuous care coordination. So on a monthly basis, if the patients do have requests, we know how to communicate with our practices efficiently to make sure, that patient requests are being processed in a timely manner. Our nurses form a bond with our patients when they do the monthly follow-up call. So they're more engaged, they feel more comfortable in sharing their information and basically feel connected because on a monthly basis, they're speaking to the nurses and connecting with them. I've received much positive feedback from patients who states how effective our program is and how effective our nurses are and efficient in managing the requests, managing their questions, concern, and facilitating the assistance, on behalf of the practice. We also, receive many feedbacks from our providers who participates in the chronic care management program on how appreciative the patients are when they receive the monthly follow-up call. Basically, it makes them feel like, they're part of this connected care, that their doctor is aware of, what's going on with them outside of their regular visits. The caretakers and the family members of our elderly patients are often thankful that we call on their patients, on their family members and their parents to assist them in with their general medical needs or pick up on issues that they might have missed, that can lead to emergencies. On one case I can share with you is this patient was really struggling with getting a part for his wheelchair, and the patient was getting a runaround from everywhere on how to get this part. Our nurses made sure that they stayed on top of this case and that the patient, that the patient received the part in a timely manner without prolonging any issues or anything that the patients might have not been able to do on their own. On a daily basis, we receive many requests, many appointment scheduling, many effective needs that the patients may need for their daily needs, so that our nurses are able to facilitate those needs and stay in connect with our practices that participates in the CCM program. And that's all I have for my end, Monica. If we can continue the questions.
Wonderful. Thank you so much, Priyanka. Okay, so I believe that we have some questions in the chat. I'm going to let Dia run over those and we'll get those answered for everyone.
All right, sure. Thank you. Thank you, Monica. Thank you, Priyanka. Thank you, everyone, for the presentation. We do have a few questions, but before we go ahead, we wanted to say that there was a little bit of issue with the sound quality, so we will rectify that. So please don't worry about it. We will share the slides after the presentation. We will have it all set for you. So going ahead, Monica, the question that I have is, the very first question is, are all interactions with patient through the app?
Dr. Barron, Anthony, James, who wants to take this one?
So sorry about that. I just realized I was on mute. So the question was, are all of the interactions with the patients through the app? So I guess the question is, of course, the interactions with the patient are virtual interactions. By definition, CCM is a non-face-to-face program. So the contacts that we're going to make with the patients are going to be predominantly phone calls, but also text messages. Now, the way that we convey the report to you on a monthly basis would actually be as a direct message into the EHR. With all that said, obviously if there's anything urgent that needed to be addressed, if a patient had any trouble getting their medication, for example, or had anything concerning on questionnaire, that would be a live conversation. So the nurse would actually call your office and inform them of the issue. So I hope that answers the question.
Perfect. Thank you.
So the next question is, does this apply to pain management?
Yeah, so absolutely it would apply to pain management. So again, the program is defined very broadly. And all that one needs to participate in the program is having 2 or more chronic conditions that are expected to last at least 12 months or until the demise of the patient. So, we tend to think about really bad things that might be within those realms, like cancer, or end-stage heart disease. However, that includes things like depression, right? Depression can contribute to the demise of the patient. Arthritis can contribute to the demise, or not necessarily the demise, but can contribute to exacerbation for the patient. Similarly, chronic pain can as well. So yes, absolutely.
All right. Okay. So going on to the next question, when do you initiate CCM? That's the first part. And the second part is it at the Medicare wellness visit?
So the CCM program really can be initiated at any point. It doesn't have to be during the annual wellness visit. Really the key points here are having a way to discuss with the patient the components of the CCM program, really talking it up, and ensuring that the patient feels comfortable with it. Obviously, when Priyanka and her nurses give the patient a call to introduce it, they'll go through all of that and answer any questions that the patient has. And once they've shown some level of comfort, then that would be the ideal time to do it. But it can be initiated at any point in time across the patient cycle.
All right. The next question is, how many patients do we need to be eligible to participate?
Yeah, so that's a great question. I would ask Priyanka to contribute as well, but certainly we have practices where they're starting at a small number, 30 to 50 individuals, and typically finding that comfort with the program, they would they would escalate from there.
I agree with Dr. Barron, yeah.
Right. So do patients need to come into the doctor's office to coordinate the plan of care, or can this be done over the phone?
Right. Yeah. So this can certainly be done over the phone and via the provider's interaction on his or her own. Let me clarify something with the care plan. So typically, the way the care plan would work is we'll submit for any individual patient a care plan based upon the individual's chronic care conditions. So if a patient has diabetes and hypertension, for example, we'll write that care plan up based upon standard of care, evidence from the medical literature in terms of what should be done for those conditions. With that said, obviously, each patient is different. So the clinician has the opportunity to revise the care plan as needed to customize it for that individual. So ultimately, it would be the clinician who would decide if the care plan that we've developed is adequate for the patient, or if other things need to be done to augment what we have.
Okay. So the next question is on the cost. What will be the cost for this addition?
Well, that's a very good question. I'm not comfortable with discussing the cost. I don't know if there's anyone else on the line that's able to better address that.
Yeah, I can jump in. So essentially, there are a few ways to work out the billing piece of it. So, and how the billing is done and who does the billing will impact the cost. And so we're basically, if you're interested in moving forward, getting a proposal, having the next step discussion, you can reach out to your sales rep or just email that sales@bismaticsinc.com email, which goes to all the sales reps. So your specific sales rep will also see that email and reach out to you. And basically what we need to do is access your database to determine how many patients would be eligible so we can work up a proposal for the services specifically for your practice. So again, if you're interested, reach out. We'll get those next steps going and kind of work through the details with you. There's not a set specific price. It's tailored more towards your volume, and then again, which specific services and who's going to bill it and how it's going to get billed, basically.
All right. Okay, so the next question is, if the patient needs to know when their next appointment is, will your CCM nurse have access to that, or will they just pass that on as a message to the practice to call the patient?
Priyanka, you want to take that one?
For users of our EMR, we do have access to that, but I do not believe we would have access to the future appointments. But if our nurses need to coordinate with your practice, and if the patient wants to know when their next appointment is, our nurses will certainly call your practice and get that info and pass it to the patient.
Yeah, so we might not have direct access to
Yes.
the information, but we're going to ensure that the patient is able to make their appointments, and that includes obviously knowing when the appointment is,
Right.
but then also ensuring that they have adequate transportation to get to the appointment, the means to get there, and that appointment is kept.
Exactly. Yeah.
Okay. We also have another question on the cost. What will be the charges to the providers to add this CCM to the EMR?
Sure, I can jump in on that. So essentially, the services will be documented in EHI's system and then transferred into Prognosis. We're still working out a few of the details there and exactly how that will appear in the system. We'll work through that on the first couple of clients. I also wanted to add one more note regarding the cost. So basically, if you don't enroll in CCM services, there's no cost, obviously. If you do decide to go with the services, this is the fee is basically taken out of a percentage of the revenue that you're generating for this. So there's no set specific cost to the practice to start the program. Basically, the monthly fees will be a portion of what is billed for the practice for the CCM services. Hopefully that will add a little bit. And we don't have, again, a flat price. We'll tailor the price towards your practice and your specialty, your reimbursement rates in your area, those sorts of things. So definitely reach out to us to get a more specific quote. But again, remember that it's only a portion of the revenue that you're billing and not a upfront cost.
All right. Few more questions, Monica. Again, on the cost, I am just reading it out to you. So we are not having to pay anything extra. It's just percentage of the income.
Correct. Mm-hmm.
Okay. So the next question is, if we refer a patient out for other services and the clinic that we refer to isn't providing the care that is being needed, will the program stay on top of that also?
So if the patient is being referred out for services, let's say you refer the patient on for, I don't know, a colonoscopy. I'm trying to get a feel for the scope of the question, and you refer the patient on for a colonoscopy, and that's not done either because the patient hasn't scheduled it, hasn't taken the initiative to schedule it, or because they're having difficulty getting it scheduled. So yes, one of the things that the nurses are going to do is to check in with the patient. They will know, of course, as part of the care plan, whether that is meant to be done or not, and they will ensure that that gets done.
All right, thank you. Moving on to the next question, is there a way for the practice to manage the CCM themselves rather than utilize the preset service offered?
I can answer that. So there are not currently CCM templates in prognosis. So EHI is using their own system and their own proprietary processes, documentation methods, etc. So you could definitely do this at your own practice. We just currently do not have that content available for you to tap into like we would, for instance, procedure templates and things like that. So the benefit here is EHI's many years of knowledge about the program, Dr. Barron and the other physicians that have coordinated on their processes and their documentation methods and things like that as well.
Yeah, and this is James Clary, and Monica, I would add to that as well. You know, one of the reasons why CCM has been extremely exploding, and I think we heard about that a little bit earlier, has to do with the fact that you have a service that's dedicated. You know, obviously, if you're going to maintain just a few handful of patients for your CCM service, you can utilize your own staff to be able to do that, and some questionnaires can be able to be answered. But what we're looking at here is, you know, more of a full service and 24-hour access to the CCM nursing staff. And I believe that's one of the questions that's coming up. And, you know, a lot of times, you know, practices don't have the capabilities of being able to manage their nurses after hours to be able to receive those calls. So that's just one of the multiple benefits of looking at a service like this.
Good point. Thanks, James.
All right. There is a question, not very clear, but it's on patient compliance in the system. So if somebody can answer that.
Patient compliance?
Mm-hmm.
Great question. Okay, so I will preface this by saying that there's a lot of variability in patient compliance from one practice to the next. And as I alluded to before, one of the things that we can do to help increase patient compliance is for the provider to really reinforce the importance of the chronic care management program. So we can do that in a number of ways. One is to put up posters that we can provide in the clinic. We can provide postcards to send to patients, as well as letters of introduction about the program. But, you know, when you're seeing the patients on a day-to-day basis, when you recognize a patient that is eligible, the best thing that you can do is to number one, introduce a program, you know, briefly. We'll obviously do that in order to give them a broader perspective on what the program involves. But then when you see patients in follow-up, to ensure that patients are still interested in the program, and to again stress the importance of the program itself. Our nurses are great, so they're very interactive with the patient. That's not typically an issue. Most patients actually enjoy the phone calls. But again, keeping them is a matter of reinforcing its importance for the patient, for the patient's health. I would say across all practices, you know, the average is probably about 50 to 60%. But again, the variability is really based upon the buy-in from the practice and how much the program itself is reinforced by the provider.
All right. So the next question, is there a requirement for 24/7 coverage for the CCM to be charged?
So the requirement is that the patient needs to be given a way to get in touch with a CCM provider 24/7. Yes, so we would provide that.
Okay. All right. The next question is, how many years have you been doing CCM? So I think it would be good to, again, kind of give an overview about the company. So yes, over to you.
Yeah, so we have been doing CCM for at least the past 6 years, which is about when the program was introduced by CMS. Priyanka, how large is our team currently?
Currently, we have 25 plus nurses working, and we are constantly hiring for nurses as well to increase our team. But I've been with the program ever since they've started, and I've seen it flourish, you know, and grow rapidly, actually.
And currently, just to give you a feel for the scope of the program, we have about 250 practices and 100,000 beneficiaries.
Okay, so moving on to the next one. And before we go ahead, I would like to let you all know that you can type in your questions in the question box on the right-hand side. We just have very few questions left. So if you have anything, please send it over to us. Going on to the next, is there a commitment period once a practice enrolls?
So in terms of whether the practice is locked into it, so again, I'm not sure of the background on that. So if there's someone else on the call that can answer, there would be a better resource than I would.
Yeah, I can take that one, Monica. Yeah, there is a certain amount of commitment, once that you enroll in the service, and part of that is just the ability for us to be able to get involved with your patients. And obviously the enrollment process, is a key piece to being able to start to build your patient population within the CCM service. So we have, a commitment for, 1 year is what we currently have as far as being able to start up your program and run.
Okay. The next question is, how many patients per nurse? Do we have
Monica,
any?
do you have a feel for the stats on that?
I do not. It really depends on the interaction that the nurses have on a daily basis and how long the interactions are. So.
Yeah, it's a good question, and the reason why it's really hard for us to answer that is because, as we'd seen a little bit earlier, some of your encounters with your patients can last 20 minutes or really up to 60 minutes, and you have incrementing numbers of CPT codes that can be dropped. So, it's unfortunate that we can't really, give you a quota that, one nurse handles, 250 to 350 encounters per month, or it be 100. So you'll see that there's a very large range in there as well. It's also very dependent upon the discipline that they're involved with. Obviously we had mentioned, things associated with, diabetes, but, you can also get into, other conditions that are chronic that can take actually a little bit longer. So there's some behavioral health items as well that, from a time component are usually longer. So it's unfortunate we can't answer your question, but hopefully you can understand why we can't now.
All right. Thank you. So the next question is a bit long question. Tell me if you want me to repeat, but here it is. What if we have a smaller number than 30? The other thing is we don't want this to supersede visits with the doctor. We find that some MA programs will have a nurse call them, then they think they don't need to see the doctor.
Well, a couple things.
Great point. Oh, go ahead. Sorry.
No, I think this is a great question, and maybe we can tag team this one. The first thing right off the bat is that the care managers, the care coordinators, when they're dealing with patients, the idea here is that there is some prep that they work with patients so that they understand when they get in to see their doctor that there's some types of questions that they can ask. So there's really no diversion from our CCM service not to get the patient back in the office. And again, there's some regulations that we have to deal with too, with how frequently that they're seeing their physician. So, and again, that's a 12-month period of time. So these patients need to be seeing their providers more routinely. As far as a small number, again, what we find is that those numbers grow over time because we've been so successful with the service offering in the past. Even when you have smaller numbers of patients, we find that, we're able to gather and put more patients into the service line, for your practice. And again, the biggest thing here is that we're also making them really involved with their care. And so when we're working with them, when they're coming in to see their doctor, prepping them to be able to ask the questions and those types of things, there is a certain amount of more involvement, but also they're sticky to your practice. Those are my thoughts.
Yeah, the other thing I would add to that is, again, with the, and I can appreciate your concern, are they going to stop coming in? Is this, the fear of telemedicine, for example, when telemedicine was first introduced, people were concerned, patients will stop coming into the office. And in fact, we learned just the opposite, that patients would still want to come into the office as long as those office visits are available. Now, with CCM, for a sick patient or a patient in whom a sickness is emerging, there's one of two pathways, right? We can wait until they get sick and then they're down the street at the urgent care center, or they are down the street at the ER, or we can find the issue as it's emerging, and be able to call up your office and make an appointment for the patient. So really what the end result is that we are actually increasing the number of visits that the patients are making to your office. We're increasing your revenue indirectly, in addition to increasing the revenue directly from the reimbursements in the CCM program itself.
The next question, I see this is the last one. If a patient is already seeing a provider once a month, can CCM still be done?
Yeah, so the requirement in terms of visits is that the patient be seen at least once in the prior year. So if they're seeing you on a monthly basis, absolutely yes, as long as they have the 2 or more chronic conditions as they're defined.
Okay. So there's one more. Who covers the malpractice liability for the nurse's action?
It's a great question. Priyanka, do you know the answer to that?
Our nurses have malpractice insurance, but I don't know how it would affect with the practice and our company.
Sure.
I don't have answer to that.
That's something that we could certainly figure out and, on an individual basis, get back to you.
Right. There's one more question, which is again related to liability, is does the practice need to buy liability?
So I personally do not know the answer to that.
All right. So I think
I don't
there
know
are
if there's anyone else on the call who does. I'm hearing actually from my colleague, they do not. No.
I think it would be covered under their regular malpractice liability since they're billing for the services. It all depends on the indemnification in the agreement too.
Yep. So the next question, can the CCM code be billed with the other office codes?
Yeah, absolutely. Yeah. So again, the CCM program is meant to be complementary to an in-office visit. So again, to be clear, and I know the webinar, the recording was not as clear as it could have been. On a monthly basis, you're going to bill the 99490 code and potentially the 99439 code. Again, the 99490 code for CCM is for the first 20 minutes of communication with the patient, as well as working on the care plan. If you reach a threshold of 40 minutes, you can also bill the 99439 code for extra reimbursement, and that 99439 code could be billed twice if you reach a threshold of 60 minutes. And again, these are meant to be complementary to the in-office visits. They're not supposed to take the place of them. The expectation from CMS as well as of private insurers is that, in fact, there may be more office visits because these patients are being kept out of the, kept out of the ER, out of the hospital, and that is expected. So yes, they can coexist. Yes, CMS and the private insurers expects the number of visits to go up, but what they're looking at is that going to your office is a lot cheaper for the patient if or for the insurer if you can intervene early and catch any problems before they reach the level of hospitalization.
Okay. So there's a question, actually, that's a statement. Would like to know the answer to the liability question after you research it. So yes, we will provide that to you. Answer. We have all the questions here with us, and we Yeah.
Sorry, I did hear from my colleague. It turns out that the provider is covered simply by the regular malpractice, so that is covered. That's not something extra that needs to be done.
Okay. We have one more question, and that is how many outgoing calls the nurses make to start the process, and what hours do they make the calls during?
Priyanka, do you want to take that one?
Sure. The nurses normally work the business hours, 9 to 5. But to cover our patients in the West Coast area, we do have nurses working different hours as well, but not later than like the business hours of the time zone. How many outbound calls depends on how much the nurse is able to cover in a day. Like if it's an introductory call, it would be a different number. If it's a follow-up call that they're working on for that day, it will be a different number.
Those are all the questions that we had from everybody today. If anybody would like to add anything extra before we go ahead.
We will be typing up all of the questions and answers into a Q&A and sharing those with everyone, as well as sharing the video. So we apologize again for the low audio quality at the beginning of the meeting, but we'll make sure and share those videos so that you can crank them up and listen to them in your own office, and hopefully that'll work a little better. And if we don't have any more questions, thank you everyone so much for joining us today. I appreciate the EHI team for all of the answering all the questions, and hopefully this has garnered a little bit of interest. Again, just reach out to your sales rep if you're interested in continuing the process, or hop on our website. There's also a phone number. You can reach out to us there as well. And we will look forward to hopefully continuing the conversation with some of you.
Thanks, everyone.
Thank you. Thank you, everyone.
Thank you.